Hello everyone. Our topic for today is telepharmacy, which is a really interesting way to give patients more privacy and more access to the time of the pharmacist when they really want input and not just to pick up their medications. And we're going to be hearing about an innovative program, a pilot program essentially, to do this in Israel. I'm Bruce Rosen from Israel Healthcare Highlights, and my special guest today is Professor Eyal Schwartzberg, who is one of Israel's leading experts on the pharmacy sector. Hi, Eyal. Welcome for joining us.
Hi, thank you for inviting me.
Terrific. So please, before we hear about the service, tell us a bit about yourself, your background. You've held so many strategic top-level positions in Israel. Please share with us.
Well, basically, I'm a pharmacist, and I've started as a clinical pharmacist and moved on until the point that I was appointed to be chief state pharmacist, the head of the pharmaceutical administration within the Ministry of Health. And I've done that for several years. Afterwards, I worked in Soraski Medical Center as Deputy Director General for um, R&D, and I've been lecturing in the university, on Ben-Gurion University, for the last 20 years. So I've sort of like started the MSc program in clinical pharmacy, and I'm also heading the Pharmaceutical Society of Israel. I'm the chairman currently for the last 4 years. So it's been very interesting.
Terrific. You've always been my go-to person when I have questions about pharmacy and pharma in Israel. So please tell us about this innovative new service.
Okay, so part of the things that we are trying to promote within the Pharmaceutical Society of Israel is the connection between patients and the pharmacist. It's not just dispensing medication, but actually helping people with their drug-related problems. And we had this idea that we will open a call center for people to call us when they have questions about their medication, because usually the interaction within a pharmacy is that you come and you get your medication dispensed, and sometimes there is not enough privacy. There are other issues that are coming back later after the medication was given to the patient. And generally speaking, those services are not that established currently in Israel. There is a shortage of pharmacists currently, well, actually for the last few years, and therefore patients don't have really access to such free service. And we thought, well, it will be a good idea to offer that. We have learned from the experience of other places in the world, and we have opened it.
Sounds very important to me. I know that sometimes going to the pharmacy can be a very technical and limited experience, not because the pharmacists don't know, just because they don't have time. It's so busy and so crowded. Now, I understand this service is particularly important for the elderly. Can you explain to us why that's the case?
Yeah, first of all, the service was introduced via an ordinary phone, no gadgets basically included. A lot of elderlies have problems with digital technology. They are not that savvy within that field, and therefore we thought that just a simple phone call, there is no need really to identify. Some people are also afraid from that. And there is no sort of like press one, press two, press three. You are immediately being transferred to a pharmacist. So the service was available during daytime and the afternoon, for 5 days a week, 3 mornings and 2 afternoons, or sometimes 3 afternoons and 2 mornings. And at that time, anybody can call. And what we have seen is that about almost 40% of the people who have used the service were between the ages of 65 to 85. So obviously, with that age group, there is a lot of polypharmacy. There is a lot of drug utilization, and there are going to be drug-related problems. There are going to be clinical issues. So this is what we have seen. So we have opened it as an initiative. We have funded it from our own money, basically from the Pharmaceutical Society. We didn't get much help at the beginning of the process. After a while, we have applied for a grant from the Ministry of Health who have assisted us with promoting the service. And the service worked for something like 8 months until we didn't have more funds to continue and doing it. But after that, pharmaceutical companies also assisted in giving us unlimited grant. They didn't ask, that we'll answer specific questions about specific drugs, just giving it as a general help to the general population. And also during the 7th of October, when things start getting really bad, we've also opened it, but in a different way, not just then we've worked almost 24 hours a day. We had like 100 pharmacists who volunteer for that.
Yeah, I imagine people needed help with their anxiety medication and things like that, right?
Yeah, not just the anxiety medication. There was also people who couldn't get their medications because they've been evacuated from the war zone, especially within the south of the country. So
Mm.
there was a lot of issues until the HMOs actually started providing the service in a robust way, especially for those people who didn't have answers at the beginning. So we've provided them with help and assistance, and we've also had a service that we actually delivered medication to their homes. If they couldn't get it, we were given their HMO cards, and we have provided the service for them. But yeah, there was
That's
a,
great.
yeah.
That's great. I think one of the things that's really striking here is it's not a university or healthcare provider that took the initiative. You at the Pharmaceutical Association took the initiative because you saw a need. You were able to give the people more time and more attention, and you're demonstrating a principle which is important to you beyond this particular service, and that is that the pharmacist is not just a technical, clerical distributor of boxes of medication, but rather is there as a real expert to give advice. Can you tell us about other ways in which you're trying to promote that broader role for pharmacists here in Israel?
So first of all, the pharmacist is a healthcare provider, such as a doctor, such as a nurse, and I think that he is the gatekeeper, he is the last chain that actually sees the patient. But it's not just providing the medication, it's providing I would say, the health or medication literacy to the patients themselves. A lot of people are not educated within medication. They might be very educated in other fields, but assuming that a patient will take his medication just because he was told to do so, that could be a wrong assumption. So we are trying to work on that. So what else we are doing with our pharmaceutical society? So first of all, we are doing a lot of webinars for the public to ask about different questions in different languages, whether it's in Arabic or whether that's in Hebrew. That's the languages which are spoken in our area. So we are providing information for patients about, let's say, ADHD for parents. We are providing other things, other sources of information, other sources of other webinars in different topics. The other thing that we are doing is that we are trying really hard to promote courses to pharmacists, giving them new skills. So, for example, in the last 2 years, we looked mainly on mental health, not just for the pharmacists, but for the patients. So giving them tools to identify suicides or people who are thinking of committing suicides and how to respond to that. And generally speaking about the medication, especially with what's going on now with all the anxiety medication and other things as well.
Ayal, that's been terrific. This is really informative, and hats off to you and your colleagues for the important work you're doing to push ahead the care of patients in Israel through the Pharmacy Association. So thank you so much for being with us here today.
Thank you for inviting us and thank you for promoting and bringing this important topic to your viewers because at the end of the day, as you said, we pharmacists are trying to be healthcare providers and also not just being professional, but being human and providing service which would be, well, it's the equity at the end of the day. It's the ability to reach everybody and not charging them. So this is what we are trying to do.
Thank you very much.
Thank you, Allah.